Hello, how are you all? Hope you all are fine and preparing well for AMC Part 1 examination. This is Dr. Zehra and we are solving some questions from the gynae section. So this question has taken from the AMC Handbook, Australian Medical Council, Section 3, Maternal Health. This is MCQ number 3.320. Let's start discussion. A 26-year-old woman present for an antenatal visit in her first pregnancy which has been progressing normally. Her routine mid-trimester ultrasound examination performed at 18 weeks of gestation shows that the placenta occupies the lower part of the uterus, reaching to within 1 centimeter of the internal cervical os. She asks you about the implication of this finding and the subsequent management necessary. Which one of the following would be the most appropriate advice? A. Repeat cardiotocographic monitoring of the fetus from 32 weeks onward. B. Repeat the ultrasound examination in 4 weeks' time. C. Repeat the ultrasound at 34 weeks of gestation. D. Repeat the ultrasound at term. E. Recommend delivery by cesarean section. So, let's first understand what this sentence means, that placenta occupies the lower part of the uterus reaching to within 1 centimeter of the internal cervical os. Let's clear this concept first. So this is the picture of the uterus. I know this is not a perfect picture, but let's understand the concept from this picture. First, suppose this is the uterus, this is the cervix, and this is the placenta. Okay, and this is there are the four types of the placenta: previa or low-lying placenta. What are these four types? First of all, understand that what is the normal location of the placenta. The placenta in normally sited position, it is at the top of the uterus or the side of the uterus. Okay, any side of the uterus or the top of the uterus, this is the normal location of the placenta. But sometimes it's happening that placenta is located on the lower side of the uterus near to the cervical canal. This is the cervical canal, this is the placenta, and this is, we are calling it, if it is this red one, if we are labeling it as a placenta previa, so we are calling it, this is the low lying placenta because it is attached toward the lower side of the uterus. So there are the four types of the low lying placenta. One is in which this we are calling it low lying placenta, but it is not very dangerous because usually these low lying placenta is 0.5 centimeter away from the internal cervical os. This is grade 1 or type 1 placenta previa or low-lying placenta. So this is not dangerous because as the uterus grows with increased gestational age, so with the growing uterus, this low-lying placenta automatically move toward the lateral side of the uterus. So it is with the increased gestational age, it's move away from the 2 centimeter away from the internal cervical os. Then if it is 2 centimeter away from the internal cervical os, with the growing pregnancy, we are not more likely labeling as a low lying placenta. If it is within 2 centimeter from the internal cervical os, then we are calling it as a low lying placenta. So but if it is 0.5 centimeter away from the internal os, away from the internal os, 0.5 centimeter away, it is low lying but is 0.5 centimeter away from the internal cervical os, we are calling it as a type 1 placenta previa. So we will again move to the question later on. First we will discuss this, what are the four types of the placenta previa, then you can understand the question and what should be the answer. Okay, so this is type 1 placenta previa, this is type 2 placenta previa. What is type 2 placenta previa? It is within 0.5 centimeter from the internal cervical os and reaches just with the edge of the internal cervical os, within 0.5 centimeter of the internal cervical os. So it is at the edge of the internal cervical os. So we are calling calling it as a type 2 placenta previa or marginal placenta because it is reaching up to the margin of the internal cervical os at the edge of the internal cervical os. So this is type 2 or marginal placenta, type 2 low-lying placenta. What is type 3? Type 3 is if it is covering the partially covering the internal cervical os. Here this is the placenta and this is the internal cervical os, and partially it is covering the internal cervical os, so we are labeling as the type 3 placenta previa because it is partially covering the internal cervical os. And this is type 4. This is fully covering, this placenta is fully covering the internal cervical os. In this type, normal delivery is not possible. We have to go for the cesarean section. Even with the type 3, we cannot give a trial if it is a precious pregnancy. In type 1 or type 2, we can give the trial for the normal delivery. So now moving to the question, what they are asking and what kind of the placenta type it is, we will see in our question again. So this is within 1 centimeter of the internal cervical os. That's mean this is type 1 placenta previa, because in type 2 we have already seen that it is a marginal placenta and it reached to the internal cervical os margin. So here it is, they have mentioned that within 1 centimeter of the internal cervical os, this is type 1 placenta previa. So first we have to clear this concept. This is type 1 placenta previa. Now basically in the low lying placenta or placenta previa, if it is 18 weeks, here they have mentioned this is 18 weeks gestation. So with the increasing gestational age, because this is the clear concept that with a increased gestational age, placenta usually going upward. It will not goes upward like in the normal sighted placenta, but it moves away from 2 centimeter away from the internal cervical os, and it is no more likely the low lying placenta in the with the increasing gestational age. And usually it is happening in 80 to 90% of the cases that low lying placenta going upward towards the in the third trimester of the pregnancy. But we have to monitor in the third trimester of the pregnancy to see that it's moves upward or not, because if it is not moves upward, or instead of going moving upward, it is partially covering the internal cervical os, then the plan of the management of delivery will be changed. Or if it is covering the fully cervical os, then we cannot give the trial for a normal delivery. So here the answer is clearly um, now you can understand the answer. So repeat cardiotocographic monitoring, it is completely wrong answer, because it is 18 weeks, and 18 weeks we are not doing the CTG monitoring. Repeat the ultrasound examination in 4 weeks time. 4 weeks time is usually not the good time period to monitor again. Repeat the ultrasound at 34 weeks of gestation. This is the correct answer. We have to monitor at the third trimester of pregnancy with the ultrasound, with the transvaginal ultrasound, to see that it is no more likely the low-lying placenta. So plan the management for the delivery. D is also incorrect. We cannot repeat the ultrasound at term. This will be a very late time to repeat the ultrasound. We have to repeat the ultrasound at 32 to 34 weeks to decide the management plan. E, recommend delivery by cesarean section. We already discussed that what are the recommendation for the delivery by cesarean section. This is even if it the third trimester of the pregnancy, if it is covering partially or if it is covering the fully internal cervical os, then these are the recommendation. But here it is 18 weeks now. The most appropriate advice is to repeat the ultrasound examination at 34 weeks of gestation. So C is correct here. And I hope this video has clear your concept. So let's see the answer of this book as well. Yes, answer is correct. C is correct. Ultrasound examination is usually performed at 32 to 34 weeks of gestation, and we can even perform the transvaginal ultrasound to see the normal location of the placenta in the third trimester of pregnancy. Okay, so if it is mentioned that transvaginal ultrasound, never misunderstand the option, because we also performing the transvaginal ultrasound to find the correct location of the placenta. Transvaginal ultrasound is not the contraindication in low-lying placenta. We can perform transvaginal ultrasound to know the correct position of the placenta at third trimester of the pregnancy. Okay, thank you very much.